And so after we kind of did her little objective exam with her, one of the main things that we kind of want to work on is to improve her time so we want to work on her to get sitting up and down faster and kind of work on it. Time improvement on floor transfers to kind of show an improvement in functional strength. And we want to continue on working on balance while walking and trying to maintain an upright posture because when she walks, she likes to lean and she doesn't really know that she doesn't have the awareness and like proprioceptive feedback to know that she's leaning. So we have to kind of provide some external cues to kind of remind her, oh, you're leaning, try to stand up straighter, and then she will. And that just working on some balance while walking will help improve patient safety.
So though I was unable to participate in the evaluation here with this client because of an illness that I had, from watching these videos, she seems to be fairly communicative and able to communicate her needs and her wants, which is what, as an SLP, I would look for. But I would ask a lot of the same questions that OT and PT have asked. What concerns do you have regarding your speech? What kinds of concerns do you have regarding swallowing? Because I know that swallowing can become, in the later stages of MS, can become a concern with the loss in tonicity and other things. So one of the big things that I would look at would be possible voice therapy down the road, and maybe looking at starting on an augmentative communication system now, as some people with MS are likely to be unable to communicate later on. So one of the great things that we as speech pathologists have in our toolbox is being able to do message or voice banking. So it's someone recording their own voice, and then we use it later on in a speech device if they are unable to communicate. And then it's their own voice in their device, which is really awesome. One of the big things that I would have done in an evaluation as well is probably like a bedside swallow is what we call it, which is basically just an evaluation of swallowing without instrumentation. So just our clinical knowledge in watching someone swallow and asking them questions about it.
All right, so the benefits of interprofessional practice and learning. So we found a study that was looking at some benefits of interprofessional learning, and they found 4 major themes about the benefits of interprofessional learning. So the first thing that they found was the development of personal relationships. So having the interprofessional learning help patients develop personal relationships with a wide variety of healthcare providers, and that leads to a genuine friendship that complemented the professional relationship and workflow. And so this relationship helped patients have a better day and look forward to their interactions with healthcare providers. And having a good relationship with the patient helps them feel more comfortable in sharing personal information and sharing their story. So that can help us form those really specific and functional interventions to help the patient more. The second theme that they found was improved education for both the provider and the patient. So the participants showed an improved knowledge of their roles and of others' roles and responsibilities. And it helped the professionals learn more about the other professions, like what kind of training they had, their values, and kind of how everybody can work the best together to provide the best patient care. The third theme was that they found that there's improved patient care. So participants realized that interprofessional teamwork had benefits on the quality of care they could deliver to patients, understanding one profession's skill sets ends and where another begins. They are able to provide more immediate and continuous care for their patients. And so having that diverse skill set allows for quicker and streamlined care for their patients. And the last thing that they found was improved job satisfaction. So working closely with other professions increased the sense of working as a team and overall job satisfaction. And so the development of roles and understanding other roles and communicating effectively are important factors and to provide better patient-centered care. And here are references, and thank you for taking the time to listen to our presentation today.